Hello everyone and welcome to Medeffe, and in this video we will be talking about anti-epileptic drugs. Okay, and I will try to make it more simpler and easy to remember for you. So let's start. Before starting, let's talk about the concept behind the seizures, and to make the concept more clear, let's make a village. So it is our village, and in this village this is our house. Okay, this is our house, and we named it as a thalamus. Okay, we named it as thalamus. Now there is only one highway there which connects our village to different other villages, to the other villages or cities. Okay, so and the vehicle is, if you want to go somewhere inside this village, you will require calcium ions. Okay, calcium ion will be required for travel inside this village. If you want to go outside the village, you have to go via sodium ion channels. It is like if you want to go somewhere in your village or your city, you have to go via bike. You can go via bike or okay, or without bike. That's your choice. But if you want to go outside your city to other cities, okay, then you will require a car. Okay, if it is very far away from your home, so you will require a car. So here the car is sodium ion channels and the bike is calcium ion channels. But the thing here is, you cannot go anywhere inside your village via your car. Okay, that's why what I am saying is, inside village calcium ion channels, outside village sodium ion channels. Now there is one chowki here, or you can say police station, and that are blocking this highway, and you have to pass this police station to go to other cities. Okay, let's start. So suppose one day all of your family members decide to go to the neighbor city. So what are the vehicles that you will require? The one is calcium ion channels, calcium. Okay, second one sodium ion channels. Then you have to cross this police station, that is potassium ion channels. Okay, and then you will be reaching the city. Now all of your family members are going to the different city. That does mean that every depolarization wave which is originating from this part of the brain, this is brain. Okay, this is cortex part. This highway is the cortex part. Okay, also although the cortex is also a part of brain, but this is the cortex part, and this via this spinal cord, these other cities are your motor system. Okay, your muscles. Okay, mainly your muscles. So all the depolarization wave that is originating from thalamus via this cortex going towards your muscles. Now all depolarization wave are reaching your muscles. That does mean there will be contraction of each and every muscle in your body. Okay, and this contraction of each and every muscle in your body will cause the generalized tonic-clonic seizure. We call it as GTCS, or generalized tonic-clonic seizure. Okay, every depolarization wave which is originating from the thalamus via the cortex reaching to the muscles and contracting them because of any disease or abnormality there. Now, what are the vehicles that you will need to go from this city to another city? Calcium ions, sodium ions, and bypass of the potassium ions. So what can be the treatment strategies for GTCS is, you can block calcium ion channels. Okay, block sodium ion, or you can open potassium ions. Okay, although there are furthermore mechanism of action by which we can stop, we can treat this GTCS, but the main mechanism is blocking of calcium and sodium ion channels. Okay, now suppose your family want to go for a shopping. Okay, this is the shopping mall here, shopping mall. Okay, so to go here you will require only calcium ion channels, and you will be concised in this city, this village. Okay, you will not go outside the village. You will not go here, then here, and then here. Okay, if there is no traffic. Okay, I am not talking about traffic. So we will require only one ion here, which is calcium ions. Calcium ions are required for this type of transmission of the depolarization wave. Now tell me friends, if there will be any symptoms of seizure will be present in our patient, if there is any wave which is going towards the muscle? No. Okay, that does mean there will be absence of the seizure. Now this absence of the seizure, we named it, we are so creative that we named it as absent seizure. So absent seizure doesn't mean there is no seizure, but there is seizure. So everything will be inside the brain. Okay, inside the brain. The patient will not show you, you cannot see any symptom, but patient is suffering from this seizure. Now there is one more seizure, which is JME, or juvenile myotonic epilepsy, or we also call it myotonic seizure, and that is mixed seizure syndrome. Mixed seizure syndrome. Mixed seizure syndrome. Okay, now this will also require, this can also be treated with calcium ion blockers, sodium ion blockers, okay, and potassium ion openers. Okay, but the basic treatment is of both calcium and sodium ions. Now the last seizure that we will talk about, before talking about that, let's discuss about some houses which is located outside your village. Okay, so these are the houses that is located outside the village. Now if they want to travel to different cities, if they require calcium ions, why? There will be no you don't allow them to enter in your city. Okay, so they will never be using calcium ions for their transport. They will always choose sodium ion channels for the transport. Via sodium ion channels they will go to different cities. Here this particular sites are the sites which are located inside the cortex, and here inside the cortex, these sites are responsible for one particular muscle contraction. Suppose there is one site which is responsible for contraction of your hand. Okay, one or two muscles of your hand. Now suppose there is any abnormality at that site, and because of that it is releasing more and more depolarization wave towards your hand. So what will happen there? Your hand will contract, relax, but other muscles of your body will be normal. So this kind of seizure, we call it as partial seizure. Okay, it is called as partial seizure. Partial seizure means seizure but which is partial and concise to one particular muscle. So what will be the treatment strategies for partial seizure? You will require a drug which will block sodium ion channels. Okay, there will be no role of calcium ions in this partial seizure, and potassium ion openers can also be used, but the first line of drug that we use is this is sodium ion blockers. Okay, sodium ion channel blockers. So that was all about the concept part in this anti-epileptic drugs. Now we will be talking about the drugs individually. Before talking about that, first we will discuss about some drugs that are having multiple mechanism of action, so you can correlate between these drugs and easily remember the the function of these drugs. Okay, so first one is valproate. This valproate is majorly is a calcium ion channel blocker, although it is having, okay, we are talking about mechanism of action. Calcium ion channel blocker, also it blocks sodium ion channel. It increases GABA, okay, both via decreasing the metabolism of GABA and increasing the synthesis of GABA, okay. And also it blocks histone deacetylase. Okay, so it will block the histone deacetylase enzyme. Now talking about the second drug here, which is also having multiple mechanism of action, is the lamotrigine. Okay, lamotrigine is the drug which is mainly sodium ion channel blocker. Okay, lamotrigine main mechanism of action is it is blocking sodium ion channels. Along with that, it also blocks calcium ion channels. Okay, so both calcium ion channel and sodium ion channel blocker, both sodium and calcium ion channel blocker. With that, this drug, our valproate, was increasing the GABA levels, but here lamotrigine has no effect on GABA levels. Okay, and the main here we were having an extra point which was a blockage of histone deacetylase. Okay, here the extra point is it decreases the level of glutamate. Okay, it decreases the level of glutamate. So that was the multiple mechanism of action for lamotrigine. Now third drug that is also having multiple mechanism of action is topiramate. Now this topiramate is a sodium ion channel blocker. Okay, and it is agonist at GABA A receptors. It is GABA A receptor agonist and glutamate receptor blocker. It blocks AMPA and kainate glutamate receptors. Okay, and the extra point is it is also a potassium channel opener. Okay, so it also opens the potassium ion channels. Now talking about this, there is one more last drug that is having multiple mechanism of action, and that is Zonisamide. Now this Jonasamide is both calcium and sodium ion channel blocker, sodium blocker, and the extra point is it is a free radical scavenger. Now a very important point here is it is a blocker of carbonic anhydrase enzyme, and most of the time if a drug blocks carbonic anhydrase enzyme, there will be side effect. There will be three major side effects that can be seen with that drug. So the first one is metabolic acidosis. The second side effect is nephrolithiasis, and the final one is hypohidrosis. So these three side effects will always be there with the drug that are blocking carbonic anhydrase enzyme. Now then we have discussed about this mechanism of actions of these drugs. Let's talk about the uses of these drugs. So via this mechanism of action, you can easily tell the uses of the drugs, and the most important drug here is our valproate. So what are the uses of valproate? You can say that it is a calcium ion channel blocker. That does mean it is used in GTCS. Okay, GTCS, calcium and sodium ion channel blocker both. So GTCS can easily be stored via valproate. Because of that, it is drug of choice. It is drug of choice in GTCS. Okay, myotonic seizure. Myotonic seizure will be blocked completely via calcium and sodium ion channel blockers. So it is also drug of choice in myotonic seizure. Okay, and talking about the third use, which is absent seizure. So absent seizure will require blockage of which ion channels? Calcium ion channels. And this drug valproate is a potent calcium ion channel blocker, so it will be a drug of choice also in the absent seizures. Lennox-Gastaut syndrome, LGS, it is also drug of choice in this Lennox-Gastaut syndrome. Okay, now other than seizures, this drugs, which is valproate, this drug is also drug of choice in rapid cyclers. And these rapid cyclers are those who are having a cycle of mania and depression for 4 or more than 4 times in a year. Okay, so cyclers, so it is drug of choice in this also, and it is drug of choice in Korea, but it is not North or South Korea, it is rheumatic Korea. Okay, so rheumatic Korea, it is also drug of choice. Now other than other uses in which it is not drug of choice but it is used in them is acute mania, and also in prophylaxis of migraine. It is not commonly used in prophylaxis of migraine because we are having other drugs for that also, and drug of choice for prophylaxis of migraine is Propranolol. Okay, so it is used if nothing works in this prophylaxis of migraine. We talked about the valproate. Mechanism of action is it is calcium channel blocker, sodium channel blocker, increases GABA, also it blocks histone deacetylase. Uses drug of choice, uses in which it is drug of choice is GTCS, MS, AS, LGS, rapid cyclers, and rheumatic chorea. Also it is used in acute mania and prophylaxis of migraine, but rarely in prophylaxis of migraine, as because the drug of choice is propranolol, and valproate is used in the if every drug is failed for the prophylaxis of migraine. Okay, if not any drug is giving us any effect, then we will be using valproate. So it was the uses. Now if we talk about the side effect of valproate, so most common side effect is nausea and vomiting. Other than this, let me make a lady. Okay, she's happy. So also the hands. So what can you see in this patient? you have given this this lady valproate for prophylaxis of migraine, and she has come to you, and she is how she looks now. This is how she looks now. Okay, so she should not be happy. She should be sad and angry. Okay, so she is sad and angry because the drug that you have given to her caused alopecia, obesity. Okay, and also there are multiple cysts in ovary. So this syndrome is called, it is a very famous syndrome, you must have heard about it, which is polycystic ovarian syndrome. Okay, because PCOS, there are multiple names of it. Okay, so these effects are undesirable, and because of this you should compare the side effect with the uses, and if it is beneficial even with the side effect, then you should go with the drug. Okay, now the next side effect is it causes hepatotoxicity. So let me make it here. It is hepatotoxic drug. Okay, so liver is also said. It is hepatotoxic. So it is contraindicated in children because of this hepatotoxicity, contraindicated in children below 2 years of age. Okay, because there is not full maturation of the liver, and we are giving a drug which is also a hepatotoxic, so that will cause more problem with the liver. This, it can cause pancreatitis. So inflammation of the pancreas. Okay, or you know what is pancreatitis. Okay, and with other symptoms, other side effects are hyperammonemia, okay, tremors can be seen, okay, tremors. Also it is enzyme inhibitor, so there can be multiple drug interactions with it. Okay, enzyme inhibitor, so there can be, and it is contraindicated in pregnancy. It is contraindicated in pregnancy. So it is contraindicated in pregnancy because it can cause neural tube defects and cardiovascular defects. Now these two defects are because of that we are indicating this drug in pregnancy. Now suppose there is one lady which comes to you who is already pregnant, and she was using valproate because of the seizure problem. Okay, pregnant. Now at this point of time, when we discussed these points, you stopped this video and never read about valproate again. Okay, and you are sitting in the OPD, and you know that valproate is contraindicated in pregnancy. So what you will be telling to the girl, although it is hypothetical situation, because you must read about valproate. Now if you tell the pregnant lady to stop the valproate, suppose you stop the valproate. Now suppose she gets, before you start the next drug or before the action of the next drug starts, in this time interval she gets seizures. Okay, and so now the child will be aborted because of the seizure, and now what will happen to you, only God knows. So now what we will be doing here, we will not stop valproate. Okay, we will not stop valproate, and we will be supplementing folic acid because we know that folic acid helps in prevention of neural tube defects, and the dose will be 400 microgram per day. If the patient is having a history of neural tube defect in her previous newborns, so we will be supplementing the folic acid 4000 microgram per day. Okay, so that will be dose, and that will be the strategy to cope up with the seizures of a pregnant lady. Now suppose if this girl is planning for a baby, she is planning for a baby. Now if she is planning for a baby, you can stop the valproate drug. Okay, valproate should stopped. Valproate will be stopped. Okay, now valproate will be stopped. Now there can be two things happen. You will check what will happen. If there is no seizures, she can continue with her pregnancy without any supplementation, without any other drugs. Okay, she can easily go with the pregnancy. Now if she has a episode of seizure in this period, you will be giving her levetiracetam. This levetiracetam is a drug of choice. We will talk about this later in this video, and this is the drug of choice for any seizures in pregnancy. Drug of choice in pregnancy seizures. Okay, other drugs that you can give is lamotrigine and clonazepam. Clonazepam is a benzodiazepine. We will be talking about it in other videos. Okay, so that was all about the valproate drug. Okay, now we will be talking about the lamotrigine. Okay, the second drug which is having multiple mechanism of action is lamotrigine. So we talked about the mechanism of action of lamotrigine. Now what will be the uses? You already know the uses. This is first line drug for JTCS, MS or JME, partial seizures. And as we have just talked about in valproate, that it is safer in pregnancy. Okay, safe in pregnancy. So that was the uses, the first line drug, the uses in which it is first line. Okay, now the second line drug, where it is used as second line. So there is the one is LGS. Preferred one is valproate. After that we use lamotrigine for the LGS, Lennox-Gastaut syndrome. Okay, now it is also used for the bipolar disorder, but mainly for depressive phase. Okay, it is used mainly for depressive phase in bipolar disorder. What will be the side effect for lamotrigine? Okay, let's denote this lamotrigine with LMT and the side effects. So the one which is always seen but not with the antiemetic drugs. Okay, nausea and vomiting, and the other is ataxia, diplopia, and yeah, this one is important, SJS, Stevens-Johnson syndrome. You must have heard about Stevens-Johnson syndrome previously, and it is a very important side effect of many drugs, and we should always keep in mind about this. Okay, and what drugs are causing this, and there is a large spectrum of drugs that cause Stevens-Johnson syndrome. So to prevent this SJS, what we will be doing, we will start with it with low dosing. Okay, and gradually we will increase the dose of this drug. Okay, so as we are using this dosing, so we can never use this drug in emergency, because we need quick action in the emergency, and we might need more high dose of that drug, and because of this we can never use this drug in emergency. Okay, so that was all about LMT and lamotrigine. So next drug is Topiramate. Okay, so let's discuss its uses here. So as you already know the uses, okay, you already know the uses. It is GTCS. Why GTCS? Because it is blocking the sodium ion channels, but it is not blocking calcium ion channels. Then why it can be used in GTCS? GTCS, because it is blocking the sodium ion channels, so that is one mechanism of action. It is also opening the potassium ion channels. Okay, so that is the two major component that is helping for the treatment of GTCS. Okay, GTCS also it is used in MS or JME. It can be used in partial seizures. Always remember, it cannot be used in absence seizure, because it is not having any action on the calcium ion channels. Then why will be using it in absence seizure? Okay, and it can be used in BPD, bipolar disorder, and also in the prophylaxis of migraine. Prophylaxis of migraine. And it is used in codependence of alcohol with smoking. So it should be used majorly in medical colleges. Okay, because they are, you know. Okay, talk about the side effects of this Topiramate. Let's go down. Okay, this is Topiramate. Okay, so the side effect of the Topiramate, it is also a carbonic anhydrase inhibitor. Now as soon as I said that it is a carbonic anhydrase inhibitor, there should be three side effects that should strike your brain. Okay, the first one is metabolic acidosis. Okay, metabolic acidosis. Second one is nephrolithiasis, and the last one is hypohidrosis. Okay, it also causes weight loss, and because of this effect we used this drug with phentermine in the treatment of obesity. Okay, treatment of obesity. It is also, now this drug also causes second degree angle closure glaucoma. Okay, second degree angle closure glaucoma. Now what is the pathogenesis behind this? Why it is causing a second degree angle closure glaucoma? Because it causes choroid edema. Okay, choroid edema. Now if this guy, it is choroid, okay, because of the edema it pushes the lens in the forward direction. Okay, now because of the push of the lens towards in the forward direction, there will be this second degree angle closure glaucoma, and because of this we will require ophthalmological examination. Okay, there will be a need of ophthalmological examination here. So this Topiramate drug is a drug that will require ophthalmological examination because of the side effect that is caused, that is second degree angle closure glaucoma. always remember the drugs that are required that are requiring the ophthalmological examination, because that is always important point and they can ask it anywhere. Okay, so now the last drug that we are having is Jonasamide, and there is no space where we can write the uses here. Okay, so we will talk about Jonasamide here. So the Zonisamide, this Jonasamide, as we have talked about, that it is a sodium channel blocker, calcium channel blocker, and also it is a free radical scavenger. So because of this calcium channel blocking effect, it is mainly used in partial seizures. Okay, it is used in partial seizure. Now talking about this side effect. Now side effect, I will tell you only one thing, and you will know all the side effect that is caused by Jonasamide. It is a carbonic anhydrase inhibitor. Now you know, okay, 3, which is metabolic acidosis, okay, nephrolithiasis, and hypohidrosis. Okay, so that was all about the drugs that are having multiple mechanism of action. Okay, now let's talk about let's come to the basics of these anti-epileptic drugs. So now we will talk individually about calcium channel blockers, then sodium channel blockers, then other classes of drugs that is used in anti-epileptic drugs. Okay, so we talked about the valproate, okay, and the epilepsy in pregnancy. So valproate is a calcium channel blocker. Other than valproate, we have ethosuximide. Okay, ethosuximide is also a calcium channel blocker. So the mechanism of action is simple. It is calcium channel blocker. Can you tell me what will be the use of this ethosuximide? Okay, come on, tell me. You know that if there is calcium channel blocking effect, what will be the major use? Okay, it will be used as drug of choice. It is a drug of choice in absence seizures. It is a drug of choice in absence seizure. Why? Because there was only calcium channels that are responsible for absence seizure. Now you will tell me that we have already talked about the drug of choice in absence seizure there in the valproate. If that is the drug of choice there, so how can be ethosuximide can be the drug of choice here? So if there is absence seizure in a child which is less than 2 years old, okay, now you know that we cannot use valproate in a child who is less than 2 years. Then what will be the drug of choice? Here it is drug of choice. So it is used in absence seizure and the child which is less than 2 year old. Okay, talking about the side effects. The side effects: nausea, vomiting, and neurotoxicity. Again, it suppresses bone marrow. Okay, bone marrow suppression can be seen here. And one more side effect is here, that is SLE. Okay, systemic lupus erythematosus can be seen with this drug. So that was all about ethosuximide. After ethosuximide, let's now we will be talking about the sodium channel blockers. And in sodium channel blocker, there is one very important drug, that is Phenytoin. Okay, and there is one more name of this drug which is diphenylhydantoin. Okay, so Phenytoin or diphenylhydantoin. So what are the uses? The mechanism of action is simple. It is a sodium channel blocker. By this thing, sodium channel blocker, you can say the uses of this drug. So it is used in, okay, you count with me, okay, GTCS. It is used in GTCS. Second one, can it be used in partial seizures? Of course it is used in partial seizures, because there is only sodium channel required, okay. Also it is used in neuropathic pain, okay, neuropathic pain. Can it be used in absence seizures? No, it cannot be used in absence seizure, because we need only calcium channel blockers there. So neuropathic pain. Then also it is an anti-arrhythmic drug. When we will be covering the CVS part, okay, we will cover the anti-arrhythmic drugs. So it is used in anti-arrhythmic drug, okay. Talking about the pharmacokinetics of the phenytoin. So pharmacokinetics is it follows zero order kinetics, that is giving it a more risk of toxicity there, okay. The route of administration is oral as well as IV route, okay. Oral is simple, we can use phenytoin, okay, oral phenytoin. And here IV preparation is phenytoin. Phenytoin is given via slow IV infusion in status epilepticus. Please read about status epilepticus and how we will be differentiating this status epilepticus from the normal epilepsy, okay. Now let's talk about the side effect guides. And there is so much of side effects because of this drug. Let's make a guy here, a guy with the all side effect that can be seen with the phenytoin, okay. So here is our guy, and the first side effect is the hyperplasia of the gums. So there will be hyperplasia of the gums, okay. Here is the hyperplasia of the gums, okay. And with that hirsutism and acne. So let's make acne. Okay, so acne, okay, acne and hirsutism in young females, okay. So always remember, we will write it later, okay, first discuss about it first. So two side effect, that is hyperplasia of the gums, hirsutism and acne. Also it can cause lymphadenopathy, so there will be adenopathy of the lymph nodes that can resemble it as Hodgkin's lymphoma. We have already talked about Hodgkin's lymphoma in our other videos. It can cause diplopia, double vision, okay. Diplopia can cause ataxia, okay, ataxia and nystagmus. And let me draw it here. So also it hampers the vitamin D metabolism, and because of this there will be vitamin D metabolism and metabolism abnormality, you can see here. So it causes vitamin D metabolism abnormality that causes hypocalcemia. In this picture we can attribute it as thin legs, okay, thin legs. So that is because of the hypocalcemia. Now vitamin K, because of the deficiency in vitamin K, there will be hemorrhagic disease of newborn. Now to help with this hemorrhagic disease of newborn, we will supplement the vitamin K as 10 mg per day dosing. Okay, 10 mg OD dosing, per day dosing we will be giving to the patient. Okay, and I think that was sufficient about this drug. So what we have learned in the side effect, that it can cause gum hyperplasia. Okay, gum hyperplasia, hirsutism and acne hirsutism. Okay, hirsutism, acne, diplopia. Okay, and lymphadenopathy, that can cause Hodgkin's lymphoma, ataxia, nystagmus. Also vitamin D metabolism abnormality, that can cause hypocalcemia. Vitamin K deficiency will cause hemorrhagic disease of newborn, for which we will supplement vitamin K with the 10 mg per day dosing of vitamin K. Now if there is diplopia, and the ataxia, the person cannot go outside his home. Okay, so we need therapeutic drug monitoring because of these two side effects. Okay, nystagmus can be coped up with, because nystagmus is just the abnormal movement of the eyebrows. Okay, so there is no need of the therapeutic drug monitoring in nystagmus, but if you see diplopia and ataxia, there should be monitoring of this drug. Okay, this drug will cause vitamin K deficiency, and because of this there will be decrease in bone matrix. Okay, bone matrix. So that is also a side effect of this phenytoin. It is also teratogenic, and it causes facial cleft deformity in the fetus. Okay, and also it causes fetal Phenytoin syndrome, in which also facial cleft deformity can be seen. It causes neutropenia and anemia also. Neutropenia, so it decreases both neutrophil count and as well as erythrocyte counts. So neutropenia and anemia. Okay, so the other sodium channel blockers that are lamotrigine, we have already talked about the lamotrigine, and Topiramate. Okay, Topiramate, we have already talked about the Topiramate. Now let's talk about the Carbamazepine. Okay, Carbamazepine. Talk about another sodium channel blocker, that is Carbamazepine, and there is one newer analog of this Carbamazepine, that is Oxcarbazepine. Now this Oxcarbazepine is a prodrug of Carbamazepine. So is a prodrug of Carbamazepine, and because of this prodrug, okay, of now Carbamazepine is having is less toxic, okay, and having less hypersensitivity reaction. Also it is a less enzyme inducer. Okay, less enzyme inducer, and it is used in GTCS as well as in partial seizure. So because of this, Oxcarbazepine is having less side effects than Carbamazepine. Now again, talking about the Carbamazepine, it is used in GTCS and bipolar disorder, acute mania, but it is drug of choice in partial seizures as well as in trigeminal neuralgia. Trigeminal neuralgia. Okay. So now coming to the side effects of carbamazepine, and the first side effect is hyponatremia. It causes hyponatremia, and this hyponatremia is a delayed side effect. And it is more common in elderly patient. Okay, and it can cause hypersensitivity reaction, it can cause eosinophilia, it can also cause SJS, Steven-Johnson syndrome, and with S you can also remember that it will also cause splenomegaly. Okay, it causes ataxia and diplopia, and because of these two side effects it requires therapeutic drug monitoring. So these are the side effects of carbamazepine: sodium hyponatremia, hypersensitivity, and eosinophilia, SJS, splenomegaly, ataxia, diplopia. And for this ataxia and diplopia we require therapeutic drug monitoring for this. Okay, it can also cause agranulocytosis, aplastic anemia, okay friends. So these are the side effects of this drug carbamazepine. Now we want to remember these side effects, let's arrange them in a different manner. So you can say that there is 3 side effect which starts from A, which is ataxia, agranulocytosis, and aplastic anemia, and 2 are starting with S, SJS, splenomegaly, and 2 starting from H, that is hyponatremia and hypersensitivity. So H2 and S2, A3. Okay, and also the last side effect, that is ED. So you can remember it via heads. Okay, but always keep in mind that what are the number of the letters that are coming and the side effects. Okay, so H2, E, A3, D, and S2. By this you can remember these side effects. Okay, now let's talk about the next drugs, and we have already talked about the lamotrigine and topiramate. They both are also sodium channel blockers. Their primary action is to block sodium channels, and Zonisamide is also a sodium channel blocker. We have already talked about the Zonisamide. Let's talk about the Lupinamide. So this Lupinamide is a sodium channel blocker. It is used in LGS, Lennox-Gastaut syndrome. And so talking about the side effects, it causes shortening of QT interval, it causes leukopenia, and the best part of the rufinamide, best thing about it is that it is metabolized by non-microsomal enzymes, so there are no drug interactions with this one. Okay, now if we talk about the Lacosamide, the mechanism of action is similar. It is also a sodium channel blocker, but it is a slow it does slow inactivation of sodium channels. It is also used in partial seizure. Why partial seizure? Because it can block the sodium ion channels, so there will be no outgoing of the depolarization wave via cortex. Okay, so it is used in this partial seizure, and the side effects, it causes PR prolongation. It prolongate the PR interval. Also it comes with the black box warning. Okay, and black box warning are given with the drugs that can cause suicidal tendency. Okay, so this drug cause suicidal tendency. So this is the special point about Lacosamide, that it causes suicidal tendency. Now talking about the polystration, and so we will talk about the potassium channel opener. Okay, what are the drug that opens the potassium ion channel? And there is one drug which is Azogabine. Okay, Azogabine, and this Azogabine is also used in partial seizures, as it has been found that it is useful in partial seizures, and also the side effects are pigmentation. Okay, now what are the places which will suffer from this pigmentation? Is the skin, lips, and the nails. Okay, so there will be pigmentation in skin, lips, as well as in legs. Also it can cause tremors. Okay, and the retinal deposits. So because of this retinal deposit, what we will be requiring is the ophthalmological examination in every 6 months. Okay, so that was all about the Azogabine, and the side effects are important, and the most important thing is the retinal deposits. Now let's talk about the drugs that decrease the level of glutamate. Okay, so the drugs that decrease in the level of glutamate, so there can be two types of drugs: the one which blocks the Nmda, and one which will be blocking the AMPA. So here they will be decreasing the effect of the glutamate, but they will be blocking the action of this glutamate. Okay, they will be decreasing the action of this glutamate. So what is the difference between AMPA and NMDA? Is that sodium and potassium increases in AMPA receptors, whereas calcium increases along with sodium and potassium influx in NMDA receptors. Okay, so the drugs here is the Nmda blocker is Carbamate. Okay, this Carbamate can be used in GTCS and as well as in partial seizures. Okay, but the side effect is The side effect is it causes bone marrow suppression as well as hepatotoxicity. On the other hand, these AMPA receptors are Pinampanel, Telanpanel, okay, these two drugs, and it is used in partial seizures. Okay, it is used in partial seizures. As I told you that AMPA receptors are more of sodium and potassium ions. Okay, so sodium and potassium ion increases in AMPA receptors, so because of that it is more used in partial seizures. There is a role of calcium in NMDA receptors. Because of this role of calcium, the Carbamate can be used in GTCS. So we are even now working with the same principle that we talked in the starting of this video, that calcium, sodium and potassium role of these three ions in different types of seizures. Okay, now the side effects of this AMPA blockers are somnolence, and mood abnormality. Okay, mood abnormality. So these were the side effects, and these were the drugs that decrease the level of glutamate in the system. So again revising that NMDA blocker are the drugs that decreases the level of calcium, that works with the calcium ions, and calcium ions majorly, then sodium and potassium ions, and AMPA majorly works with the sodium and potassium ions. Okay, just remember that there is something role, and sodium and potassium in the AMPA majorly, and calcium majorly in the NMDA. Also sodium and potassium in NMDA, but not that major than the calcium. So because of that, NMDA blockers can be used in the GTCS as well as in partial seizure, and on the other hand AMPA blockers can also only be used in partial seizures. Now the next class of the drug is the drug that increases the level of GABA. Okay, drugs that increases the GABA effect. Okay, overall effect of GABA. So this glutamate gets converted into GABA. Okay, now this GABA, it is vesicle, this one is vesicle. So this GABA will go out from this system, from this presynaptic neuron, and will work on the postsynaptic neuron, where there can be two types of receptors. Okay, the first one is A and the second one is B. Now this A works in brain, and the second one B is works in spinal cord. The A receptor is a chloride ion channel, and it gives us the anti-epileptic effect. Anti-epileptic effect. Also this spinal cord, this is of potassium channel. Okay, it opens potassium channel, and it is used as a muscle relaxation. It is the function of this is muscle relaxation. Okay, so also this GABA can be metabolized by the by the enzyme called GABA transaminase. GABA transaminase. Okay. And so this was the basic behind the GABA and release of GABA and how it works and how it metabolizes. Okay. Also, there is one thing that I would like to discuss is here these calcium ion channels are important for the transport of this GABA outside the neuron. Okay, but these calcium ions get endocytosed by these channels again by the channels. So because of this, the GABA release decreases after some time. Okay, now talking about the drugs. Okay, so the first drug that we will be talking about is the Pre-Gablin and Gabapentin. The Pre-Gablin and Gabapentin. These two drugs, they go and they bind to the presynaptic. They go and bind to this presynaptic calcium ion channels, and because of this they block the endocytosis of this calcium ion channels. Because of this, there will be more release of GABA. Okay, there will be more release of GABA. So more release of GABA, more of the anti-epileptic effect. Okay, more release of GABA, more it will work on this A receptor, GABA receptor, and there will be more anti-epileptic effect. Now talking about the uses of this Pre-Gablin and Gabapentin. So it is used in partial seizures as well as in peripheral neuropathy. Okay, peripheral neuropathy. If I talk about the gabapentin individually, this gabapentin can be used in the prophylaxis of migraine, again in the bipolar disorder. Okay, and GAD, generalized anxiety disorder. Also it can be used in post-herpetic neuralgia. Okay, and the pharmacokinetics of this is there is this gabapentin have no drug interaction as it is not metabolized. Okay, so it is excreted unchanged, and there because of that there is no drug interaction with the gabapentin. Okay, also it can cause weight gain and edema. Okay, weight gain and edema can be seen with these drugs. Now talking about the next drug that inhibits the reuptake of GABA. So there we forget one phenomenon, that is a reuptake of GABA. Okay, this presynaptic neuron reuptakes the GABA from this synapse. So there are some drugs that block this reuptake of GABA. Okay, and the most one of them is the tiagabine. Okay, tiagabine. Now this tiagabine, the mechanism of action is it blocks the GABA reuptake. Okay, that we are discussing. Also it is used in partial seizures. So as you can see, most of the drugs are used in partial seizures, and the side effects. This is the drug that is used for seizures, and the side effect is also a seizure if you administer this in a non-epileptic patient. Okay, so for the non-epileptic patient, it works as an inducer of the seizure. So you should always be careful while prescribing this drug. Okay, so to a non-epileptic patient. Now it also, one side effect of this is psychosis, so it causes psychosis. Now there is one drug that blocks this enzyme. Okay, if we block this enzyme, the drug is named as Viagabatrin. Okay, now because of the blockage of the this transaminase enzyme, what will happen? The GABA level will increase. Now GABA levels will increase, and because of that, it is used in drug resistant partial seizures. Okay, so it is used in drug resistant partial seizures. Also it is used in infantile spasm. Now there can be two variation of this infantile spasm, and that is if it is associated with tuberous sclerosis. Okay, associated with tuberous sclerosis. If it is associated with this tuberous sclerosis, the drug of choice for this is Viagabatrin. Okay, if it is not associated with tuberous sclerosis, not with tuberous sclerosis, then the drug of choice is ACTH with steroids. Okay, so this was about Viagabatrin, and the side effects are it causes irreversible visual field defect. Okay, so a very important side effect that can be asked in MCQ, that which drug which is used as for anti-epileptic use and it causes irreversible visual field defect. Okay, irreversible visual field defect. Now if I talk about the about a drug which is a GABA A agonist, that is ganoxolone. Okay, so it is a GABA A agonist, that is its mechanism of action. The uses will be of course in partial seizure as well as in infantile spasm. Okay, and if the second drug which is also a GABA A agonist is Stereopental. Okay, Stereopental. Now Stereopental is have two mechanism of action. The one is it is a agonist on GABA A. Also it increases the level of GABA. Okay, so the both are the mechanism of action for this Stereopental. The use of this is in Dravet syndrome. It is in Dravet syndrome. What is drug of choice? Drug of choice for Dravet syndrome is also Valproate, and this Stereopental is a add-on drug in this Dravet syndrome. Also we can use clobazam in this Stereopental in this Dravet syndrome. Okay, side effects are anorexia. Side effect is anorexia, and because of this anorexia there will be weight loss. Okay, so side effect is anorexia and weight loss. Let's talk about the last class of the drug, that is SV2A. inhibitors. What is SV2A? SV2A is synaptic vesicle glycoprotein 2A. Okay, that helps in release of neurotransmitter. Now suppose this is presynaptic membrane, and in this there is a synaptic vesicle. Okay, this is synaptic vesicle, and here we have excitatory neurotransmitter. Okay, now here our SV2A will be here. Okay, now this helps in release of the excitatory neurotransmitter. Suppose here excitatory neurotransmitter is glutamate. Okay, now the drugs are levetiracetam and brivaracetam. Okay, now this levetiracetam is having two mechanism of action, as it is a calcium channel blocker as well as the SV2A. It binds with the SV2A and inhibits it. Okay, so these are the two mechanisms. As it is a calcium channel blocker, uses can be GTCS. Okay, also the same with the, okay, both are helping in the mechanism, in the uses. Both mechanism of action are helping. So GTCS also myotonic seizure, it can be helpful in partial seizure, and status epilepticus, and also in levodopa induced dyskinesia. Okay, we have already talked about the levodopa and other drugs in Parkinson's video, so you can check it there. Induced dyskinesia. Okay, here this brivaracetam, it is not a calcium channel blocker, rather it is a sodium channel blocker. Okay, and also the same function, it binds with the SV2A and inhibits its function. So mechanism of action, and because of this it is used in partial seizure only. Okay, now this levetiracetam, it can be used as monotherapy and pregnancy. Okay, pregnancy and epilepsy in pregnancy. Okay, or it can be used as a polytherapy and also in epilepsy in pregnancy, with I have already talked about it, which is levetiracetam. Okay, levetiracetam, lamotrigine and clonazepam. Okay, now what are the side effects of this levetiracetam? Is it causes bone marrow suppression, as well as it causes mood abnormalities. Okay, mood abnormality can be seen with the levetiracetam. What the last one is cannabidiol. Cannabidiol is an older drug, and it is not mostly used nowadays, and the mechanism of action is also unknown, and the use is LGS, Lennox-Gastaut syndrome, as well as in Dravet syndrome. Okay, Dravet syndrome, and the side effect is hepatotoxicity. Major side effect is hepatotoxicity, and because of this we have to monitor the ALT, AST. Okay, and also it is contraindicated in children below 2 years of age. Okay, so that was all about the anti-epileptic drugs, and I hope you guys will like this video, and this will be helpful for you. And if you have any doubt, you can ask in comment box, and thank you guys.